Great. Good afternoon, everyone. Good morning to some. Welcome to the July 13th edition of Mount Pacific Quality Health It's Worth a Shot series. We have a few folks joining us still from the waiting room. I'll just give them a few more moments. All right, I think we'll kick it off. Again, good morning to some and good afternoon to others. Welcome to the July 13th edition of Mount Pacific Quality Health It's Worth a Shot series. My name is Jessie Kinsey. I'm a registered nurse as well as account manager with Mountain Pacific Quality Health. And today's session, we are going to discuss vaccine education resources for rural health communities, as well as share the Alaska vaccine journey. Next slide, please. As usual, a few housekeeping items. Feel free to add your webinar topics and any ideas or needs into the chat box. And we will continue to meet every Wednesday. Next slide, please. Once more, happy to extend a many thanks to all of our guest speakers, partners, and attendees to continue to support the needs of our long-term care facilities across our region. Thank you all for joining us today. Next slide, please. So with that, we will kick off the first topic of conversation for today's discussion: vaccine education resources for rural communities. Next slide, please. So to best align the resources for our rural areas, where many of us that are joining today really identify as our community, we need to better understand our rural challenges, and then we can align those resources to best meet our needs. So really, the rural challenges in our areas, we need to make sure that we assess so that we can provide accurate information. And as we know by now, misinformation has really taken a lead in as far as the line of challenges that we face on a regular basis, and is really considered one of those barriers. Creating those trusted sources in our community has been a challenge for a lot of folks. Community and having those community advocates. If we don't have one of those individuals identified in our community, that's often one of our biggest challenges. We can also look at structural and system barriers that definitely contribute to our challenges as far as COVID-19 vaccine distribution and vaccine uptake. So for example, when we talk shortly with our coworker Barb in Alaska, we really saw a lot of structural and geographical barriers. And so it was noted early that we needed to identify those barriers and see the best way to solve so that we could address vaccine uptake. And really, some of those rural challenges that we're continuing to see is really personal experience. Until there's a personal experience with a lot of folks, they're still continuing to not choose to be vaccinated. Next slide, please. So vaccine confidence, just as we review this, vaccine confidence really is the trust that people have in recommended vaccines and how they're administered and developed. And until folks have a better understanding of that vaccine and some confidence, truly people will not move forward with immunization. And until you have that understanding and assessment of vaccine confidence in your community, it makes it real challenging to align those educational resources. Next slide, please. Another important pillar as far as identifying barriers and challenges so that you can best meet those educational needs is assessing awareness. Assess if individuals understand what vaccines are recommended for them and why. I know it's especially challenging to really understand some of the booster timelines, especially for folks that may have had Johnson & Johnson as a primary vaccine. And um, even if we take that discussion and extend it beyond COVID-19, I know there's a lot of confusion around pneumococcal vaccines right now. So being able to assess the individual's understandings of those recommended vaccines is definitely of key importance to align those educational resources. And do folks understand where, how, and when to obtain vaccine? What are their resources in the community? Not only that, but do they understand how to access them? Vaccine safety is a huge one. That kind of plays back to vaccine confidence, and do your community members and residents and family members, do they understand how the vaccine was developed, and how can we support that understanding with accurate information? And really, what role does the employer play with the employee, and help with the staff vaccination uptake, and extend that on to family as well? And what role does family influence play when we look at trust and vaccine uptake? So next slide, please. So that brings us to really, where do we start? So when we really examine our unique rural communities, we have found that having a vaccine ambassador has really played a big role on vaccine uptake. If you have someone in the community or within your workplace, within your group, within your friend circle, that is willing to speak up to answer questions and provide accurate information, we've seen that influence, it plays directly on increase in vaccine uptake in communities, specifically rural communities. So when I think of this, having a vaccine ambassador, here's a perfect example. For a small Montana rural community, you have men's coffee clubs in almost every pocket and corner of our towns, as well as ladies. But I think of men's, and I think back to an experience I had actually with my dad that's gone to coffee every morning for the last 40 some years. And initially when the vaccine rolled out, I recall him calling and saying, there's a tracker in it, and this is what the guys are saying at the coffee club. Is this true? And I was able to recognize in that moment, boy, we might have a capacity to dispel some misinformation in our small town and almost create some vaccine ambassadors by the coffee club. So, I was able to tell my dad that, no, there's no tracker in the vaccine, and explain the reasoning, and, help share the benefits and the risks of the population, and especially the older men that were in his coffee club, how they were really the group that would benefit the most from getting a vaccine. And that message, he did take back to his coffee club. And I will tell you, those guys got vaccinated. And so, that's small town trust. That's just my little story about creating a vaccine ambassador, almost, literally. But I think of the impact that has, especially again in our small towns, and really small towns potentially throughout the rest of the country. Where we start too, when we look at our workplace vaccinations, access to vaccine is paramount, and we're seeing the biggest impact where the vaccine is brought to the employees. So they don't have to worry about running down to public health or coordinating their day off with the immunization hours that have decreased in some counties. We're seeing a greater vaccine uptake really when you can bring that vaccine to folks at their place of work. What we're also seeing that has a great impact is text message or email reminders, and really catering the message within those texts to your age groups. So for example, some text messages for maybe some of your younger staff, if you form the conversation around social norms, so saying maybe your information for your vaccine uptake rate for your facility. Something like, so many of your fellow employees have already chosen to be vaccinated. Here are the risks. Hey, we're going to have a clinic on Thursdays between 2 and 3. Be sure to sign up at the front desk, something like that. And then also those same messages, you could distribute those in an email format. We're really seeing though where that text template or text messaging is becoming a popular way of communicating with the employees, but not only that, it's a well-received method of communication. And there's programs out there that through the text, if employers push that out, the employees can then schedule and make a vaccine appointment through that same text. So, ultimately coming down to what's effective messaging for your population, whether it be staff, residents, family, tuning into the most effective messaging for your population, again, is important. And coming up with ways to combat misinformation. Do you have a plan in your facility where you routinely update information, or maybe it's stand up, take the opportunity to dispel rumors or dispel misinformation. There's a lot of media and posters that are updated on a routine basis, and it's a great opportunity to print those off and post them for your staff, residents, family to see. And we have some communities that will mail those out. So with that, next slide, please. So here's kind of the this is the good stuff. These are the resources that I want to share with you guys. Specifically, okay, that's great. Well, how do I create a vaccine ambassador? How do I send out texts and work on my messaging for my families and my residents and my employees? So I've been able to, and this is the hard part, I completely understand. I've been able to track down some resources and narrow down some information that I'll send forward to you guys. And what I'll do is I'll copy and paste it and put it in the chat box here in a sec. But this first resource is more of a community guide or community toolkit, and it contains strategies on that the very objectives I just talked about on how to create a vaccine ambassador. So that's the first link, and I'll put that in the chat for you. And then the second one, oh, and it looks like someone just did for us. Thank you so much. And then the second one, the Montana Office of Rural Health, there is a plethora of COVID-19 training resources in there that range in topics, including kind of a high-level overview to scenario-based training, and to identifying barriers and adjusting to those barriers and hesitancy and responding to them. That's the Montana office, the second link there, courses COVID-19 training. That is a free training, so feel free to access that. These other public campaigns, the COVID-19 public education campaign, this is a great resource because it has templates for sending out text messaging to your staff or creating letters for your family speaking to COVID-19 vaccinations and the benefits, and really just dispelling misinformation and sharing forward education. These other links through the Rural Health Association, these are fantastic resources again, to update media, maybe posters. This last link, vaccine hesitancy, this was a education scenario-based training that is another free training that was recently launched within the last month, I believe, that is for caregivers as well as healthcare providers, again, to look at how to address vaccine hesitancy. Another free training. All wonderful resources. They're in the chat. They're ready for you guys. And with that, I will go to the next slide, please. So very smooth transition here, rural vaccine resources. And I am super excited to share our peer up in Ketchikan, Alaska, account manager with Mount Pacific Quality Health, Barb Bigelow, is joining us. And she comes to us as a much experience in the administrator world and long-term care. So as we kind of pass the baton here, Alaska's vaccine story. Barb, you have the floor.
Okay, Jessie, thank you so much. I appreciate your kind words. So good afternoon, everyone. It's really good to be with you again. I've enjoyed these series immensely. I joined Mountain Pacific in February, but prior to that, I spent many years as a nursing home administrator and was really boots on the ground through the first 2 years of the pandemic. So tell you a little bit about Alaska's story as a state. So next slide, please. Okay, so Alaska at a glance, we really were early leaders in the delivery of the COVID-19 vaccine. And like all of you, I felt really, really fortunate when CMS announced that nursing home staff and residents should be in the very first wave of those who were eligible to receive the vaccine. And I think, you know, we're a huge state geographically, but we're a small state because almost all of us know one another in the long-term care nursing home setting. So, and we had lots of great partners. You know, CMS announced that CVS and Walgreens would be distributing vaccines, but outside of urban Anchorage and Fairbanks, the majority of the state didn't have a Walgreens or a CVS for thousands of miles. So we worked directly through our state and with the vaccine delivery model system, and we're able to really effectively get those vaccines in and into the arms and out into the places where we really need to start the distribution. We had a very strong centralized public health model. We were led, still led by Dr. Ann Zink, who's our chief medical officer, and the people at the Department of Epidemiology and Health, where we had twice, sometimes 3 times a week. For a while, we had daily calls with state leaders, and our hospital association was very engaged. So we really had a centralized and an organized approach to the pandemic as well as to the vaccine. Geographic barriers, oh my goodness, thousands of miles between communities. And in most cases in Alaska, these communities are not roaded communities. So you get there by a snow machine or by float plane, or in some circumstances, Alaska Airlines does fly to a lot of our small communities. So next slide, please. Respiratory viruses, they circulate year-round in Alaska. I mean, we do have a flu season. We do follow the CDC protocols, but it is not unusual in a cold, wet, rainy, snowy place to have a lot of respiratory viruses with adults and children. So there's always that balance between, is it COVID or do I have a cold, and all the precautions that we needed to take. COVID-19 transmission remains pretty high. Alaska as a state is probably about, I just saw a presentation this morning from a colleague, and it looks like we're probably about 65% of the entire state is still completely in the red zone in terms of COVID infections and transmissions. Hospitalizations in Alaska are starting to creep up again due to the, the continual variants that are happening. And yeah, most parts of Alaska are now at the high community levels. So next slide, please. This just shows, this is just a graphic COVID-19 cases among Alaska residents. This is really where it peaked, of course, and I'll be the first to admit this was among the scariest time of my life. Much better control, but still an issue in a small community. It doesn't take much to infect a lot of people and impact the workforce adversely, because if you have a staff of 5 and 3 are out with COVID, you're kind of down. Next slide, please. We had great messaging. These are just a couple of graphics talking about the kids, sleeves up for the summer. Really like that. That was a more recent campaign. And then next slide, please. This was one of the earliest graphics we had. Alaskans stand together, 6 foot apart. And I'd be willing to bet that there's a pair of extra tufts in every Alaskan household in this state. I mean, this is what we just wear when we're outdoors oftentimes. I've even seen people wear extra tufts to work. And then, we really worked closely with the fishing industry and the tourism industry and seafood processing and supply distribution really worked hard so that we were really pushing the information out for everybody for the importance of public vaccines. Next slide. So this is a really fun photo. This is a group of folks who landed on the float plane. This is courtesy of Yukon-Kuskokwim Health Corp. I worked for them for almost 2 years, and what a remarkable experience. In the winter, the only place to get to the villages was by snow machine. And then there's a couple credits here. Dr. Hodges is the medical director at the big YK hospital in Bethel, and a nurse colleague who's drawing up vaccine. And of course, we had all those challenges at the beginning because it had to be kept at a certain temperature, 5 dose vials. I mean, there were so many complications that are not so much complications anymore. Distribution's a little bit easier. Next slide, please. And then the next slides, couple slides are just fun. This is a place in remote Southeast Alaska. The only place to get there is by boat or float plane. And this was a picture of the vaccine delivery. This is a nurse here on the left with her ice chest full of vaccine, and the middle slide, they're going back to the float plane. And then the next slide, please. I think this is the last slide with photos, but this little guy was my girlfriend's son living in a very remote part of Alaska and getting his first vaccine. And I think the look on his face is probably the look on the face that all of us had when we received our very first vaccine. I was first in line, but I will admit I was a little scared too. So next slide, please. And I think that might be okay. And here's our vaccination rate. 1 dose, we're at 71.8%, and completed the primary series, we're at 64.6%. And I think if you look all the way through the boosters, it's starting to drop off just like it is in a lot of places because people are thinking, what's the point? I already have it. And I think that's where we need to target our continued education. And next slide. Okay, and so these are some resources. And so especially for Alaskan colleagues, Sarah Aho, that is her email address, and you can order postcards from her. And then here's some information on social media resources. And then I wanted to say, Jesse pointed it out in a previous slide on this series, without some level of confidence, people will not move forward with immunization. And that is just so true. People just really need to believe that the vaccine is not going to harm them. And I think the role of ambassadors is really, really important. I worked at a hospital and a nursing home where the director of nurses at the nursing home was the ambassador, extremely effective at it. She would just sit down with anybody and talk to them about why it was important and what not to worry about, and convinced many, many people. And then, of course, CMS eventually required that we all have all of our staff vaccinated, and that really helped in many, many areas. But I think it's better to bring people to the table willingly than unwillingly. Next slide, which I believe is probably the last. Yeah, so questions. Just one thing real quick. Jessie told the story about her dad and his coffee group. I know I was at a presentation quite a while ago from the Washington State Department of Health. And one of the nursing home administrators said that there was a rumor circulating in her home, and it came right out of social media, that the vaccine had chopped up baby parts in it. And people were just like, no, I'm not getting that vaccine. And so I think one of the things to remember is that many of our staff are younger, and social media is where many people receive their information today. So the more we can put at their fingertips in sound bites that are digestible, I think the easier for us to continue. And of course, we're all ambassadors, right? It's not just the folks who work for us, it's our communities, it's Rotary, it's Chamber, it's Kiwanis, it's the quilting group, it's the dinner club. We all have an opportunity to be ambassadors for the vaccine. So Jesse, let's see if there are any questions in particular about Alaska or about our presentation today. And thank you so much for being here with us.
Thank you, Barb. What a wonderful presentation. I really like sharing the Alaska story with everyone else, because I feel like it makes us feel not so alone in Montana and Wyoming and Hawaii. And so thank you.
You're welcome.
Any questions, you guys?
I see some stuff in chat, but I'm not sure. Oh, Dana in extra
We're mostly
tufts.
noticing the extra tufts, yeah.
They're really comfortable. I can hike 10 miles in a pair of extra tufts. I love them. I love them. Yeah.
Got mine in clogs in the boot, and then the pull-on like ankle boots. So I've got 3 different versions of the exact same boot, but just because they're so useful. In the summer, I use the clogs to mow the yard. So
I love it. It looks like a lot of compliments. I don't see any questions. Again, we've placed all the linked resources in the chat box. Feel free to pluck those out of there. As always, our presentations are recorded, and we will send out the slide deck and the recording ahead of the next presentation, and you can also access them on our website. And I don't see any questions, Barb.
Okay. All right. Well, thank you, everyone. Go forth and do good work.
Thank you, everybody. Feel free to fill out the survey link that's in the chat box. Let's see, I believe it's up above now. This concludes our Wednesday, July 13th edition of It's Worth a Shot. Thank you for joining us.
Thanks, Jesse.